Hey everybody, Mark Dawes here once again, and today I want to talk to you about spit hoods because they're quite a controversial thing and people don't like them, and certain organisations say you can't use them and some say you can use them, but they, in the main, a lot of organisations don't like them because they feel that you may be breaching someone's rights. But my good friend Bill Coyne has recently been in touch with the Health and Safety Executive. Now, Bill works for the NHS. He's a hugely experienced restraint trainer. I've known him for many, many years. He's a credible guy. And he recently inquired to the Health and Safety Executive about the use of spit hoods and the regulations that apply to their use. And Bill very kindly sent me the email. And what I'd like to do now is to read you exactly what Bill got back from the Health and Safety Executive. This is what he got. And this is from this person here. I've redacted their name from hse.gov.uk. It was sent to Bill on the 4th of February at 3 o'clock, just gone 3 o'clock in the afternoon. And the subject was Re-Advice Health and Social Care, Bill Coyne. And the HSE representative has said, "Dear Bill Coyne, my apologies for the severe delay in replying to your query. Unfortunately, we have had a number of people who have moved on from the team and this has led to a backlog in answering queries. This query has come to me as the policy lead on mental health care in the NHS. The relevant section in our COSSH guidance says," and COSSH, if you don't know, is the control of substances hazardous to health. "The general duties of COSSH apply to incidental exposure to and deliberate work with biological agents. However, COSSH does not cover a situation where, for example, one employee catches a respiratory infection from another. This is because Regulation 2(2) specifies that COSSH only applies in those circumstances where risks of exposure are work-related and not those where they have no direct connection with the work being done. Incidental exposure to biological agents can occur when an employee's work activity brings them into contact with material which contains infectious agents, e.e. blood, bodily fluids, contaminated water, waste material or bedding, laundry, etc. In summary, saliva may contain blood-borne viruses and other infections, therefore COSSH would apply. The specific control measures to be used is a decision for the employer based upon the level of risk. It should be noted that the legislation from one regulator does not take priority over another regulator's legislation. And from the HSE's point of view, any control measures should satisfy all applicable legal requirements, including those from care regulators." And it's signed from this gentleman from Her Majesty's Inspector of Health and Safety. Now, a lot of you out there will have dealt with stuff like this. I've come across it before in my career where staff are trying to physically control someone, for example, and they may be trying to spit in that person being controlled, may be trying to spit in a member of staff's eyes. And in those cases, we have recommended on occasion that they consider the use of spit hoods, and we've had organisations or management of organisations come back and say, well, we don't really like them because they don't look good and people complain, etc., etc. But if the level of risk dictates that someone could catch an infection from a blood-borne virus, and if someone has gum disease, for example, and they maybe have an infection like hepatitis B or C or HIV or something, that blood can get contained in their spit. And if that gets into someone's eyes, the effects can be devastating. And a spit hood, which is a piece of equipment that's been made and designed specifically to cover someone's face to stop that coming out, so it will have been industry tested, is in many cases the proper piece of equipment to use. Now, if employers don't use them simply because they don't like them, so just get this right, you've got a piece of equipment that's fit for purpose, has been industry tested and medically reviewed, and it can protect staff from a blood-borne virus in saliva, for example, and they fail to do that, and a member of staff gets contaminated by that and suffers as a result of that, their health deteriorates or they lose sight in their eye, then that employer potentially is liable. So I just thought I'd share that with you. Bill, thanks ever so much for passing that on to me. Very kind of you to do so. I hope it helps a lot of you, and I'll be interested in your comments, and feel free to share. Thanks ever so much. Speak to you all soon.